After months of fears, agony, and a new normal occasioned by the outbreak of the coronavirus pandemic, the world now hopes for a new dawn following the manufacturing of some vaccines in the United States of America and the United Kingdom. The government of Ghana has assured that the country will not be left behind in having access to the vaccine. This announcement is exciting for some Ghanaians who have for some past 8 months compromised their normal way of doing things, but others are raising safety concerns.
If you make example like hepatitis B disease, we can't cure it, but because of the vaccine, we can prevent ourselves from spreading it. So I think for the coronavirus, when we get the vaccination, it's good to help. Like if you have, you cannot vaccinate it, but if you don't have, then you inject it, you will not get it. So it's good.
For me, it is good because we are all tired of wearing this thing. And wearing this thing sometimes if you wear it, you can't breathe well. So if you have cold and stuff like that, if you get tired. So for me, it's good. So we can go for a vaccination so we will stop wearing this thing, so we can have our freedom. I'll go for it because it will help us. At least it will stop the spread of the virus, and it will help us to stop wearing this thing too.
Vaccines have their advantages and disadvantages. So the pharmacists or the scientists need to look at the side effects of those vaccines. You get it? Because there are some vaccines that they will take, they will give to you, and to give you other side effects. So the scientists have to come out with the side effects. We need to know the truth about the vaccines, what it's going to do to your immune system, and as I said, the other effects that are also associated to the vaccines. So from that view, we can be able to know whether the vaccines are good or not.
Even though the World Health Organization is yet to give authorization for any of the vaccines produced, 3 of them have received national authorizations, with one of them, the Pfizer vaccine, expected to undergo assessment by the World Health Organization. The Ghana Health Service has been explaining to Citi News which of the vaccines will be procured by Ghana.
In fighting an epidemic, in this case a pandemic, which is just an epidemic that crosses continents, one of the key arsenals is vaccination, if it's an infectious disease. And so there has been the talk of development of vaccines over the past few months, with all the hullabaloo about it, and that the COVID vaccines probably will be one of the fastest developed vaccines based on the threat to humanity, and not just lives, but even livelihood and all that. Therefore, you as a country, you cannot just stand aloof and watch. You also need to prepare.
In the United States and United Kingdom, where trials have begun for some of the vaccines, there is a heated debate as to which group of persons should be a priority in this administration. There, however, exists an unanimous agreement that health workers should be prioritized, a point the Ghana Health Service agrees with.
Based on the data, not just in Ghana but across the globe, you have people like health workers. They are the first line of action. So when it comes to a vaccine, health workers will be considered, security agencies and other essential service providers, of course, those with what we call underlying conditions, which most of the deaths are usually associated with that. And then the elderly or middle-aged or people who are old, like 60 years and above.